This is Dr. Don from Movement Medicine in Montrose, Colorado, and today I'm going to talk about specific and non-specific low back pain. Non-specific is what 98% of people have, meaning that we don't know exactly what is causing the low back pain. It could be a little bit of disc problem, could be a little bit of nerve problem, could be some muscle spasm, could be some joint dysfunction. All those things go into non-specific low back pain, and that's what you might see on your diagnosis code or on your super bill. Non-specific low back pain. Specific low back pain is much more rare in that we can actually look at one particular structure and say, that's what's causing the problem. And that's very rare because, like we've talked about, low back pain is often multifactorial. And the fact that you could pick out one structure and say that that's causing the back pain is pretty rare. However, there's a physician and he's a researcher in Canada, Stuart McGill, and he would say that 90% of people have specific low back pain. In other words, we can identify the structure if we can just look for it in the right way. Now, this could be a red herring for many cases, or it could actually be true in some cases. So let's say when I turn my head and look this way, all of a sudden, oh, I get severe neck pain, or the same thing with the low back pain. If I bend over and just when I get to almost touching my toes, I get shooting pain. Well, he claims that if we did a fluoroscopy, which is an x-ray with a movie camera on it, so instead of just one picture, you actually see the spine moving each degree, and when that person gets to the point where they're almost all the way bent over at that same position, something moves, something shifts, and that's when the pain happens. Maybe, but it doesn't change the fact that the treatment is very often the same. The treatment is that we have to find that motion that is tolerated and then slowly expand it. So let's say that person has pain when they go bend over into that 60-degree mark. Well, then let's stop at 59 degrees and keep getting it stronger and more mobile in those degrees. And then over time, maybe we can push into that 60-degree range and pass that pain mark that was previously painful into a new level of movement. We can do that by mobility and by strengthening. And that's exactly what we do in my office because many other types of care have proven to be ineffective. Thanks for watching, and stay tuned for more on low back care and treatment.